सगळ्यांक येवकार. प्रायम आयुर्वेद ह्या कार्यावळीन तुमचे परतून एकदा स्वागत. दर फाटसारखे ह्याही फाटी आमी एक वेगळो विशय तुमच्या मुखार घेवन आयल्यात. आजच्या ह्या कार्यावळीचो विशय जावन आसा पांचभौतीक चिकित्सा आणि ताच्याच बद्दल आज आमकां सांगपाक आमच्या बरोबर स्टुडियोन आसात डॉक्टर जिजीत रविंद्रन. डॉक्टर, तुमचे खूप खूप स्वागत.
थँक्यू.
डॉक्टर जिजीत रविंद्रन हांणी आपले BMS शिक्षण गोमंतक आयुर्वेद महाविद्यालय शिरोडा हांगासरल्यान केला. तशेंच तांणी योगा इन्स्ट्रक्टर कोर्स वो स्वामी विवेकानंद योगा अनुसंधान संस्थान बेंगलुरू हांगासरल्यान केला. डॉक्टर सुशीला सजी थ्रिसूर केरला हांच्या हाता सकयल तांणी केरला स्टायल ऑफ आयुर्वेद प्रॅक्टीस हाचें प्रशिक्षण घेतलां. गेली 12 वर्सां ते केरला स्टायल आयुर्वेद प्रॅक्टीस आणि पंचकर्म थेरपी तशेंच तांची जी स्पेशालिटी आसा पांचभौतीक चिकित्सा जाचे प्रशिक्षण तांणी डॉक्टर विवेक हळदवणेकर हांच्या सकयल घेतला ते प्रॅक्टीस करतात. तांचे स्वताचे आयुर्वेदिक क्लिनीक आणि पंचकर्म थेरपी सेंटर श्री शांती वेलनेस नाचनोल हांगा आसा. तर सराचे परतून एकदा स्वागत करून तुमकां पयलो प्रश्न विचारता. म्हाका सांगात, पांचभौतीक चिकित्सा म्हणजे कितें? व्हॉट डू यू मीन बाय पांचभौतीक चिकित्सा?
Okay. So most of the textbooks it is explained Tridosha Chikitsa. If you look at all the Brihatrayas, Charaka Samhita, Sushruta Samhita or Ashtanga Hriday, the diagnosis and the treatment is based on Tridosha, that is Vata, Pitta and Kapha. But we learned it in the first year itself, everything is made up of panchamahabhutas. Panchamahabhutas are like Akash, Vayu, Agni and Prithvi.
So these are the 5 elements.
5 basic elements from which everything in this world is made up of. It's very similar to the modern science. Like we all know the atoms are made of neutrons, electrons and protons, and these atoms then build the elements and the molecules, then the atoms, from there everything is built up. So we all know the base is panchamahabhutas. So in Panchabhautik Chikitsa, instead of thinking about the Tridosha, we think about Panchamahabhutas. So suppose like any particular disease condition, we all know that this is because there is increase in Vata or decrease in Vata. Instead of that, we will think about what Panchamahabhuta has the imbalance, whether the Akash Mahabhut has gone up, or suppose the Akash Mahabhut is gone down, something else had gone up. So there is always an imbalance. So we think in terms of Panchamahabhuta. That is the basic difference of Tridosha based Ayurveda Chikitsa and Panchabhautik based Ayurveda Chikitsa. If you look at the medications, what we give is all the same. There is no difference. Yes, slight modulations are done on the medications, but otherwise the medicines are the same. But the thinking process is so much different.
So it's on more subtle level.
Yeah, so this is more towards the base, more towards the root. So you are diagnosing towards the root, what exactly is the imbalance of the body. So unless you correct the imbalance of the root, it's not going to be cured. So there is no symptomatic treatment. Yeah, symptoms are considered as giving some light to what exactly is the disorder, and we give the medicines according to that.
So as you told, this treatment is based on the 5 elements, Panchamahabhut. So as of what I know, this whole universe is made up of these Panchamahabhutas, 5 elements. So how this principle is applied to our body? Like if we try to imagine, we cannot see all the elements, but how it is applied?
Exactly. So see, even when we know that everything is made up of atoms, and atoms are made up of neutrons, electrons and protons, we can't see them, but we can identify them. We know that it is there. In the similar way, Panchamahabhutas are identified by its qualities. There are 20 qualities which is explained in Ayurveda. Vimshadi gunas, we say. With these 20 qualities, we can identify whether it is pointing towards Akash Mahabhut or Vayu or Agni or Jala or Prithvi. So with this quality, we identify which Mahabhuta is present in a particular disease condition. For an example, if I say, a simple example I am giving you, acidity. Acidity is like burning sensation. Sometimes it comes up. we know that there is Agni Mahabhut involved. There is burning sensation.
Heat.
That it's heat. Agni Mahabhut is there, and it is in the liquid form. So there is Jala Mahabhut also associated with that. So we know that the disorder or the imbalance is with Agni and Jala. So what we need to control is only that particular two Mahabhutas. So it is towards the point.
To the point treatment.
To the point treatment. It is towards the root. We know that okay, these are the two things which has to be corrected, and we do that. So when it comes to the whole world, everything is made up of panchamahabhuta. That's why we say whatever changes happened in this world will affect the body also, because the world is made up of panchamahabhuta. Whatever we see in this world is made up of panchamahabhuta, and our body is also made up of panchamahabhuta. We can't see panchamahabhuta because it is the minute undividable part.
Like we cannot see atoms.
Atoms, neutrons, it's in the same way, but we can identify by its quality. So when up to the level, even Tridosha, even we say that we are diagnosing everything on the basis of Tridosha, we can't see Tridosha. So it's very simple way to explain that there is no physicality for that. It's an energy, but it is there. Its presence is there. We can identify the presence, but if somebody want to see that, it's not possible, but they can identify, they can understand it. That is how it is.
Yeah, like current. We cannot see current, but based on lights, we can say that it's there.
Exactly.
So tell me, who is the initiator of this concept? How it started and how it got developed over the years?
So this particular treatment is developed by a senior Vaidya called Atmaram Vaman Dattara Shastri ji, who was born in 1909 in Dapoli Taluk of Ratnagiri district. So he was blessed in his childhood. He got the opportunity to learn Ayurveda at the age of 13. Okay. Yeah, because you know that education system was something different at that time. And he was doing his schoolings, and to appear his 7th exam he had to wait for another 4 or 5 years. That time he decided to go and join a senior Vaidya in his village, and 4 years he learned Ayurveda. And after completing his terms with Vaidya, he rejoined the school, completed the school, and after the school again he joined for Ayurveda, and he finally did his graduation and even the post graduation Ayurveda Acharya. That time the Ayurveda Acharya is almost equivalent to our MD right now. Okay. That is in 1938. Since then he is practicing in the Konkan area only. So when he's so in his biography it is written, this thought process of Panchabhautik Chikitsa was there from his 2nd year of Ayurvedic course. So he had some kind of thought like, why don't we think about Panchamahabhuta? Why we so always thinking about the Tridoshas? And even his first book, he has written it, all the details about how the Panchamahabhutas and how it is important to the world, and what is the importance of diagnosing the disease through Panchamahabhutas. Everything is written. So he gave prime importance to Akash, Vayu, Agni, Jala and Prithvi. So if we explain it, it's very interesting. We know that from Tanmatra the Panchamahabhutas are formed. This is a little bit more of theoretical, but I'm still telling, so people may understand that. Then from Akash, Vayu is formed. From Vayu, Agni is formed. From Agni, Jala, and from Jala, Prithvi.
From space, everything is.
From space, everything is from, and the quality of space is the sound. So Akash is there everywhere. So that is why the sound, there is something importance to give to the sound. So sound is there everywhere, and from sound, so that is how, if you look at this particular treatment, there is something called Nada Pariksha, the percussion of abdomen. So we tap the abdomen in the clinic and we listen to the sound. From the sound we identify the imbalance of Panchamahabhuta, and on that basis we give the medicine. So this is slowly how he developed, and it's well explained in his biography that he was having so much of research mind. So when in the clinical practice, if some patients are coming, he used to note it down, like what are the clinical correlations, and a lot of observations he had done, and then gradually he developed this system. for which he is actually awarded Brihatraya Ratna Award in 1995.
Yes, so such a huge personality. So now the doctors who are learning this will be benefited, like from the books what he has written, his observations will benefit today's generation. But every time it will be a new experience, right? Like each patient, everything you see is different each time. So tell me, what are the plus points or advantages of using this particular therapy technique in your clinical practice?
So I can tell that we can divide this into two. There is advantage for a physician and advantage for a patient. Looking at the physician, it takes very little time. Because what we need is, initially when the patient comes, we need to take the history, and after that, when we check the patient always in empty stomach, and when we tap the abdomen, we listen the sound. The tapping the abdomen, listening the sound hardly takes 2 minutes. Within 2 minutes of that technique, we are almost towards the conclusion, like what is really the imbalance of the body. Rest is all history. That is one prime advantage. The other advantage is, like, whatever the patients don't tell to you. See, it's not possible that every patient comes to you and they will tell you everything. They will hide something, or they may forget. When you do this Nath Parikshan, you always get into the history of particular disease, which can be the cause of the present disease condition. The present disease condition can be the secondary towards the
Which
something
may have
happened.
been concealed.
Yeah. So that even if the patients are not opening the mouth, we can identify that. This is something like the pulse examination. When the pulse examination, the patient they don't need to tell exactly what it is, like we can identify. So this is something like that. Towards the patient, the advantage is that again it's time saving for them also. They come to our clinic, within 5 minutes the consultation is over, and that's one of the advantage. Other one is Datara Guruji had developed this system in such a way that the medications what we give is in a very little dose. So it will be surprised to see in Panchabhautik Chikitsa, the dose of medicine is from anywhere from 15 mg to 125 mg. Milligram, it's not even grams, milligrams. So imagine, like, we are giving only 4 medications into 2 doses. The per day dose is maximum of 800 milligrams.
Okay, so my next question is, how are these medicines chosen? Like such a fine dosage, something has to be there, like this fine dosage will work on that particular person. So how is this particular concept designed?
Actually, this concept was there in the textbook, because every textbook has mentioned how to collect the drug, when to collect the drug, or what time it has to be administered. Now the problem is, we are living in a modern world. Most of the public know about the modern medications or the timings of the medicines to be taken according to that. The simple thing is, like, we have to stick to our theory. Whatever is mentioned in the Ayurvedic textbooks, like the 10 specific time periods were mentioned about taking the medication, that we have to stick. Also, Datara Guruji had experimented a lot with the medications. So the medicine collections were mentioned clearly, like what season the medicine has to be collected. The other thing is, there is always the scope of improvising the potency of the medicine. So the multi-stage process was done to improve the potency of the medicine, so through which the dose can be reduced. So we can give always a minimum dose.
People will think, like, such a little medicine, how will it work on me? That is the basic question people will have.
Yeah. See, mostly the public go to the internet, they try to find out what is the dose of particular medicine, but that is always a general information. Imagine, we doctors taken a little effort to process the medicine into, instead of doing one process, imagine we do 3 processes for that medicine. So the potency is increased almost 3 times. So we can reduce the dose almost, like 1/3.
Yes, and it will be palatable, it will be easy to take.
Yeah, so they won't even identify the taste of the medicine by the time it is already gone inside.
So those are the advantages.
Those are the advantages. And also I have have seen, whatever medicines are mentioned in the classical textbooks, Dattara Guruji had added some or the other extra drug to that to improve the potency. So that this is again the advantage, because he always think towards the panchamahabhutas. He know that this medicine has to work in this particular area, in this particular condition. What another drug can be added into it? That thought process was there. So basically these theories are all the guidelines. Tomorrow any doctor can do this.
Just have to apply the right.
Has to apply the theory. So the philosophy has to be hold always. Then you can play around with it. It's an interesting game actually when it comes to the practice.
So doctor, as of now you have told us about advantages of Panchabhautik Chikitsa, how it is performed. Can you share a few examples or cases what you have successfully treated with this particular form of Chikitsa?
So the very interesting part of Panchabhautik Chikitsa is it can be applied to any chronic diseases, because the disease is developed within the body. With the Panchabhautik Chikitsa, we are going into the root cause. So when the disease develops within the body and we are finding what is the root cause of it, it is pretty much easy to treat all kind of chronic diseases. Where there is no solution, or it is very tough to give a right solution with other kinds of medications. In my practice, most of the cases are definitely all the Ayurvedic clinics, lot of arthritic cases used to come, which is again chronic. Skin disease, it works well for psoriasis. Psoriasis cases can be treated very well with this. Even has treated PCOD, because we know that it is like a lifestyle disorder, the change in diet and regimen which cause the hormonal imbalance in the body, by which this had happened. So these kind of diseases are always developing within the body. Again, in the skin disease, have seen wonderful result with vitiligo, Shvitra. The white patches what we see on the skin. So these are some of the disorders we actually treat. Also other diseases like kidney diseases, kidney stones and all we used to treat. But in my practice, these are some of the major.
So vitiligo can be treated?
Which one?
Vitiligo can be treated?
Yes, absolutely. But see, again, whatever is written in the textbook, we cannot forget, because there are certain conditions of vitiligo which is said that which can be treated. Some are said which cannot be treated. So we cannot go against the textbooks. So when we know the case is okay, looking at the case, we can identify whether it is treatable or not. If it is too chronic, it's spread all over the body, and there are particular lakshanas which is written in the textbook which we should not treat. That means it cannot be treated, but otherwise we can treat that.
What about use of this particular chikitsa in children and pregnant women? Can this chikitsa be used in them as well?
It is absolutely safe, because it is basically Ayurvedic and we are all using the herbals.
Because the dosage for a normal adult you said is so less, so dosage for a child?
Again, for the child we reduce the dose, because we know that according to their body weight that will reduce. So you will be surprised, most of the cases when the child comes, we give the medications up to 30 milligram. And it really works within 4 to 5. See, mostly the kids comes with the disease condition like the cold, cough, fever. This is commonly seen. Otherwise, some kind of skin diseases, allergies they come with, which can be easily treated.
Okay. So how long is this procedure, like this chikitsa done? How do you decide the course of the treatment?
Within if it is a disease condition like fever or cold, within 4 to 5 days definitely it will go. If it is a chronic disease condition, within 1 week we will get to know how the progression is.
Based on again the sound?
Yeah, again, because we used to check the patients every week or every 15 days. So every 15 days during the follow-up, we will get to see what are the changes happening in the body. Imagine a condition was there in the body for last 1 year. They can't expect we will take it out in a month. It will take its own time. It's not about the treatment. There is nothing wrong with the treatment. Every body has its own pace. So we have to work according to their body's metabolism, their bala, the strength of the body. So imagine somebody is really weak. They are already in the weak stage. and their digestion is poor. So unless we correct the basic things, we cannot go for the right treatment, so they cannot expect the result quickly. Whereas if some youngster is coming, they are already in a good metabolic condition, the medicines will act fast.
So tell me, how is this Chikitsa, Panchabhautik Chikitsa, different from other forms of Chikitsa present in Ayurveda? Like Panchakarma therapies are there, then pain management therapies are there. So how is this Chikitsa different from that?
See, every Chikitsa is mentioned or written with a different intention. So in the classic it is clearly mentioned. So the doshas in the body, if it is going beyond a limit, there are different stages of dosha. We have to analyze, like, at what level the imbalance is there. If it is beyond the limit, then definitely we have to give a Shodhan Chikitsa, because we need to take it out through a detox. I mean, I don't know whether to use the word detox, but to the modern world, to everybody to understand, we have to use the word detox. So because it's too much in the body, with the medication it will take a long time.
Whatever excess is bad.
Yeah. So to cut down the time period, we have to give a Panchakarma therapy initially, then we can start with this medication. But if it is not that bad, and we can directly start with the Panchabhautik Chikitsa. Again, in Panchabhautik Chikitsa, there is prime importance given to the Rakta Dhatu, the blood, because blood is the carrier of everything to the body. Every nourishment happens with the blood. So the blood has to be corrected. That is why Dattara Guruji mentioned the prime importance is always given to the liver, spleen and the kidney. So the examination is done on these three. And even my guru, Dr. Vivek Haldwanekar, he always used to tell that when there is swelling in the kidneys, you have to give particular medications to first remove the swelling of the kidney. So it was a very interesting. One of his friend who was a modern doctor, once he asked the doubt, like, why you are always doing the kidney examination, and how it is relevant. So my guru said, like, instead of giving Ayurvedic medicine, you can even give your modern medicine to relieve the swelling. And he tried that literally, and he found there is a lot of change. So what we have to think is the theory. It doesn't matter what is the medications, because ultimately the body is the body is the same. Like, it's when we look at the modern medicine and Ayurvedic medicine, how they look and how we look, it's only the perspective is different. The body is the same. We learn it in a different way. We have Sharira Rachana, that is a anatomical point of view, and they have a different way of looking at it. Nothing is wrong, everything is right.
As we come to the end of this episode, you have some message or appeal to the audience, then you can please.
I would say, like, every disease is formed in the body because of some cause, and the cause is very important. So better to the public, I would say that don't try to do a self-diagnosis. Go to an expert, get it diagnosed, and take the medications. And when you go to any Vaidya or any place, if somebody suggests you, other than a doctor, if suggests you some medication, don't try to take it, because when somebody suggests that medicine, they don't know what it is for, or like how it is going to act. Whereas an Ayurvedic doctor, they are always analyzing your body, understanding what is going to work, and they know exactly what is the pathology and where to break the pathology. So and don't believe that all the herbal medicines are Ayurvedic medicines, because in the world, lot of Ayurvedic products are there, lot of herbal products are there. So don't try to take the herbal products thinking that there is, it is all safe. We say that Ayurveda doesn't have a side effect. It is because the way of thinking is like that. If you take something in excess without knowing how it is going to work, there will be some effect in the body. If it is not the right effect, it is always a side effect. So that way you all have to take care.
दोतोरान हांगा करेक्टली सांगिल्ल्या प्रमाणे की सेल्फ मेडिकेशन करनाकात, सेल्फ डायग्नोसीस करनाकात, एका रेजिस्टर्ड आयुर्वेद डॉक्टरा कडेन वचूनच तुम्ही ट्रीटमेंट घेयात. आज पांचभौतिक चिकित्सा ज्याबद्दल ताणी आमकां सांगलें, 5 महाभूता जाच्या पासून ही सृष्टी तयार जाल्या. आकाश, वायू, अग्नी, जल आणि पृथ्वी. जशी सृष्टी तयार झाल्या तसे सृष्टीतले सगळे ह्या 5 महाभूतांपासून तयार झाला. आमचे शरीर सुद्धा, आम्ही खाता ते अन्न सुद्धा. तर ह्या इथल्या सूक्ष्म पातळीचेर विचार करून ही चिकित्सा केली वता. सो असो आज वेगळो कॉन्सेप्ट आमकां कळ्ळो, त्याच्या बद्दल हांव दोतोराक देव बरें करूं म्हणटा. खूब खूब धन्यवाद.
थँक यू सो मच.
आमी असेच वेगळे विशय घेऊन मेळुया. तोपर्यंत पळयत रावात प्रायम.